explained it to me where, you're going to have this surgery and that's going to last this long. And then you'll have another surgery and that'll last that long. And eventually we'll run out of options and you will have to have an amputation. And it's such a life-changing thing.
Imagine being a mom at your son's baseball game, but you can't even walk 20 feet to your car without bursting into tears. That was Camille's reality. Camille, looking back, you must have felt like you were losing your mind, right? Hurting that bad while being told nothing was wrong, right?
Right. And that's how you feel. You feel like, because when you're stressing, like I can't walk, my toes are going white, and they're still absolutely ignoring what you're saying, that it makes you feel like there's maybe mentally there's something wrong.
I can only imagine. It took one critical question from a nurse practitioner to realize Camille wasn't having a cramp. Well, not a cramp that you would imagine just from everyday lack of nutrients or from too much exercise or an injury. She was actually having a massive vascular emergency. And today we are joined by Camille and her vascular specialist, Dr. Hady Lichaa, to talk about the misdiagnosis that almost cost her her leg. So, Dr. Phillips, this is going to be a really powerful, I think, Save My Piggies episode.
Save My Piggies, your life, your limb, your story, with hosts Interventional Cardiologist Dr. John Phillips and Global PAD Association CEO Kym McNicholas.
Yeah, I mean, we've been doing Save My Piggies now for a while, and I think there's some momentum there, and it's inspiring to me, and I hope to you, Kym, as well, to just allow patients to tell their stories unbiased, like, hey, lay it all on the line. We'd love to hear from the physician or physicians that have helped the patient. So, Hady, thanks for joining us. Camille, we're really excited to hear your story. And really, it's meant to be an inspiration for patients and to never really, we'll never give up, frankly. So I do have, I found this quote. It's unknown, so I don't know who said it, but it spoke to me a little bit with respect to when we get a patient who doesn't take no for an answer. I think that's really important to kind of highlight that, and particularly folks at a young age. As a cardiologist, I had treated a gentleman today that was under, or not today, but a couple of days ago, that was under 40 who was having a heart attack. So it's really scary, like how early this onset disease can happen. So at any rate, so this person is noted as saying, I fight for my health every day in ways that most people don't understand. I'm not lazy. I'm not special. I'm just a warrior.
Wow.
And that's so true, Camille, because you were actually at a baseball game when in watching your kid and you were, doing mom things, right? Standing up and rooting for him. And you got up to go to the car and suddenly what happened?
Well, I went to go to the car, and about halfway there, my legs started cramping pretty bad. And I tried to continue walking further, and I just couldn't walk any further. I called my husband, who was also at the game. He was behind me. And I said, I can't get to the car. He said, what do you mean you can't get to the car? And I said, well, my leg is cramping so bad. I don't know what's going on. And at that point, he helped me to the car. And then we went to the walk-in clinic. And that was the first time they missed it. So they just said it was a cramp and to drink water and that
Eat a banana.
Eat a banana. And I was shocked because I hadn't been doing any excessive exercising. I was drinking enough fluids. It was just shocking, but I thought, okay, I'll just drink the water. Maybe this is just some, weird cramp that happens. And, I went on my way, but that's how it originally started. And it was pretty frightening.
Camille, can you,
I mean,
sorry, can you share with the audience? So, a cramp is a cramp, and
Right.
sometimes we get those. But did you have any, we talk about risk factors for disease processes and for PAD. Our risk factors include, diabetes or tobacco use or things. Do you have any risk factors for?
The only one I had was smoking. I was a smoker. I finally quit I think I'm at the 7-month mark now. So yeah.
Awesome.
good job.
That was the only one. I don't have any diabetes. I had some history with some kidney problems, but other than that, no other history. And when I say cramping, this was debilitating cramping where you just cannot walk anymore.
Because you've had muscle cramps, right? When you were a kid, you've
Right.
gotten a Charlie horse. Is there any analogy that you can give that would explain to people the difference between your standard Charlie horse that can be debilitating for some, and then this type of cramp from lack of circulation known as peripheral artery disease, which is what you ultimately were diagnosed with?
Well, it's literally like you cannot take another step. It is that bad. It's like somebody grabbing that muscle and just squeezing it. And like I tried to explain to the emergency room when I went on a separate visit to have this checked again, my toes would go white. And even after explaining that in the emergency room, the doctor at the emergency room still handed me a prescription for muscle relaxants, which I handed back to her. I said, I don't want these, because then I started thinking that she was maybe thinking I was there for, pain medicine or something. So I handed the prescription back to her and said, I don't want it. This has been going on for a while. I've seen several doctors by this point, and no one seemed to know what's going on.
So,
I did.
Camille,
I'm sorry.
Sorry, walk us through. So, one question: the first episode when you went to the emergency room after the game, did anyone examine your pulses at all in your leg or assess for?
Yeah, did you have to take off your socks?
I don't remember doing any of that. I know during one of my visits, they did send me for an ultrasound, and I think she said they were looking for a blood clot.
Mm-hmm. So how many visits did you have? Like, how long did this go on for?
I think it originally started with the walk-in clinic, and then, and I'm not sure if at that point they had sent me for an ultrasound. I know I had gone to at least one emergency room visit, and it was finally of all things, a nurse practitioner who really listened to what I was saying and said, I'm going to send you for an ultrasound. And I said, listen, I've already been for an ultrasound. They didn't find anything. And she said, well, they were probably looking for a blood clot and they wouldn't have seen it on this type of ultrasound. So they would have missed it. And I remember going in for the final ultrasound, and I could tell by the tech's face that something was pretty seriously wrong at that point. And if it wasn't for that nurse practitioner, I don't know where I'd be.
And coming up next, right here on the Heart of Innovation, we'll find out the diagnosis, which I think everyone kind of knows what it is, but I want to hear that conversation between Camille and that nurse practitioner. That's next, right here on the Heart of Innovation on KDOW. Don't go away.
How many procedures are you willing to go through? Is it worth going through that many, or would you rather just cut
That's funny. Was it worth it? Oh yeah, I have my leg, man.
Amputation should absolutely, positively, 100% never be a first-line treatment.
What an incredible operation, what an incredible lab you have here.
Without a doubt, we're underdiagnosing peripheral arterial disease. It has not gotten the attention that it should, because it is a killing disease, it is a disabling disease, and most importantly, it's a disease that we now have great treatments for.
Okay, let's go to the next one.
They were going to amputate it, and I needed to consult with my family. Did I want it off here or here? You're just shocked. It's scary. I don't even know how to explain it. You're 42 years old.
We're waiting till people are at the end of the spectrum and almost beyond hope. There is good care available here. Closed minds are what we have to get rid of.
Welcome back, everybody. Camille, thanks for joining us for another fantastic Save My Piggies. So I think during the break we were kind of chatting a little bit. Walk us through, you go to the walk-in clinic, they tell you it's a cramp. How many days go by till the next ER visit and then the other ER visit? And I'm assuming the duration of time gets shorter with respect to some of your symptoms, but things must have gotten a little bit better because, at least in my experience, when someone has a limb that is acutely threatened, like it's something that kind of moves pretty quickly, like a volcano, so to speak, and erupts. So this is kind of smoldering a little bit, it sounds like.
Well, to tell you the truth, it kept getting worse. But they kept telling me there was nothing wrong. So in my head, I almost felt like, it was something in my head and not with my body, but it got so bad that I couldn't walk literally from inside my house to the car.
But so that's really powerful what you just said there, because I have to imagine if someone would have examined you like assessed for pulses or done something to look for the arterial blood flow, they would have found something wrong. It sounds like there's a bit of a tease here, right? But I'm assuming this is what's going on. But yet you felt like, yeah, maybe there's something wrong. There's nothing wrong with me physically, mentally, maybe I'm off. Like that's very powerful, right? Like that, explain that to us if you can.
Well, you're listening to the professionals and you've gone to the professionals to help you. And they're telling me that there's nothing wrong. So in my head, I'm thinking, God, there's got to be something wrong. But they're telling me there's nothing wrong. You know, when I was in the emergency room, I remember this female doctor specifically. I said, you know, I'm cramping really bad and my toes are going white. And you would think that that would be kind of like the light bulb for the doctor to just look. And she didn't even look. She just wrote a quick prescription for a muscle relaxer, handed it to me. And I handed it back to her because I didn't want it, because I knew by this point, this had been going on for a little while. I'd already been to the walk-in clinic. You know, I knew something was wrong. And even though they kept telling me there was nothing wrong, it was just a cramp, I knew there was something more serious going on. But to be honest, I'd never even heard of peripheral artery disease. I didn't even know what it was. So it's not like I knew what it could be. I just knew there was something seriously wrong with my leg and it wasn't functioning like it's supposed to.
You and more than 70% of Americans don't know about peripheral artery disease. So you're literally, you're not alone. But I could imagine it. What kept you going with this? Because hearing doctors dismiss you and dismiss you and dismiss you, at some point, you must get tired, must get burnt out.
I was frustrated, and you know, it's really, it's almost depressing because you know there's something wrong, and yet the professionals keep telling you there's nothing wrong. You know, I was very lucky at some point that someone finally kind of had an idea of what it might be, and of all people, it was a nurse practitioner. And she said, let me send you for an ultrasound. And I told her, I said, listen, I've already been for an ultrasound. And she said, well, they were probably looking for a blood clot and they would not have seen it on this specific ultrasound.
And just to clarify for our listeners, they're most likely looking for a blood clot in the veins. And every once in a while, they incidentally find something in the artery. But it sounds like the nurse practitioner had enough insight and hopefully examined you that said, yeah, something's wrong with the arteries. And right. I'm assuming that's kind of what they did, right?
Right. And I think it really just boils down to somebody who was really listening to what I was saying. Because anybody else who would have been listening, especially if I said, you know, my toes are going white, you would think that that might have been a light bulb for someone to, you know, go down the road of peripheral artery disease. And she was the only one. And I'm very grateful. I'm very grateful.
Yeah. We would love to honor her if you want to name her, but also tell us what happened once you were diagnosed, where you went from there.
Well, so that started a long road of surgeries, and really just for me kind of delving into some research, even what peripheral artery disease was and how it's going to affect my body and what I was doing to contribute to the problem. Yeah, so it started with several interventional surgeries, and then I got to a point where the doctor that I had been referred to said that he was out of options. And I said, "What do you mean you're out of options?" He said, "Well, this is we've tried this and we've tried that, and I don't have any other options for you." And I was not willing to take his word that that was the last option, and I'm glad I didn't. And I found another doctor at a little bit of a bigger hospital, and I thought, you know, they'd be able to do a little bit better for me or find another option, and they did. But then at some point, he was also out of options.
How many procedures did you have?
I want to say 1, 2, 3, 4. I probably had 4 procedures before I saw Dr. Lichaa. And I think with Dr. Lichaa, I think I had 3 total.
Right. Yeah, right? Dr. Lichaa.
Correct.
Bring us back.
Yes, welcome.
I would love to hear that first encounter with Camille.
Absolutely. If you don't mind, I'd love to kind of from this story, obviously, Dr. Phillips and I, see patients all the time with difficulties like that. We're struggling in a healthcare system that's broken, that's overwhelmed, where even knowledgeable doctors and nurse practitioners are overwhelmed, and even patients would have to be very proactive in their care. The follow-up is compromised. Then you add the complexity of the procedures that are available and the new knowledge that's accumulating every day. So this is a multifaceted issue that we were fortunate to meet Camille at the right time, but other people are not that fortunate. And it's a combination of luck and resources and will and education, etc. So going back to Camille, I had the pleasure and honor to meet her in the emergency department. One of my colleagues, emergency department physician, very compassionate, very good clinician, who actually identified the problem and gave me a call and told me, listen, she was told that she has absolutely no options. And he told me she's young and, there has to be something. And I believed them. I came in, it was like 7 p.m. or so. And then, of course, I knew your case was extremely complicated. But like you said, we're not going to give up. Someone young like yourself and with all the technology that Dr. Phillips and I are training on and learning about every day, we thought there should be an option. And basically, in a nutshell, to summarize her case, she's had an initial stent behind the knee, which subsequently fractured in two pieces. And that led to a lot of scar tissue formation, which blocked the artery. Subsequently, she had bypass surgery around that blockage, which subsequently blocked. And then she had another bypass surgery, which also blocked probably a few months later. Then her doctors took her and placed stents in those bypasses, surgical bypasses. Some of them were successful for a short while. Then, long story short, all of them blocked at the end. And we met her in that kind of situation where two bypass surgery in a young woman, healthy otherwise, and we needed to find a way to get through.
Coming up next, right here on the Heart of Innovation, we're going to find out how they got through and how she's doing today. So stay with us right here on the Heart of Innovation on KDOW. Don't go away.
When your sugar runs high, it's more than a sign. Diabetes creeping in, it's a dangerous line. Pre-diabetes too, don't think it's too light. It can lead to PATS, so start the fight. Sugar's sweet, but the cost is real. High blood sugar makes your arteries feel clogged. Slow flow, it's a ticking time bomb. Catch it early, stay strong, and keep your legs on. Sugar's not so sweet when your leg is in pain. Not controlling sugar is where peripheral artery disease sets in. Got sugar? Get checked. Don't wait too late. Save your legs, save your life, take control of your fate. Leg pain, cold feet, neuropathy too. These are signs diabetes caught you. High sugar's the link where circulation and pain left untreated. Your leg might end inflamed.
Welcome back, everybody. So let's get right back into it. So, Dr. Lichaa, the problem that you encountered, that we've all had, I had this same issue this week actually, is the durability of what we do. Right. Whether it's endovascular, meaning balloons, stents, atherectomy, or surgical, this stuff just doesn't seem to last. And I know you're going to tell us that you've tried something different. And it's hopefully it's successful, but like at what point when you see the patient, do you, because now Camille's on our third opinion here, and obviously you're looking for something, you want to help her, but we all know in the back of our heads, like this is not going to last forever. How do you mitigate what you can do, what sounds like what you've done that was successful, knowing that at some point it's going to fail, and talking to the patient about like risk versus benefit and expectations and durability of the whole process, because she's got to be frustrated. We get frustrated. I get frustrated as a physician all the time about this.
Right. No, absolutely. I mean, and Camille and I had a lot of long talk before we started even going through the long procedures that we had to have her go through. But we knew that this is going to last a few months from the technology that we have right now. But like you and I go to conferences all the time and we see what's on the horizon. We're always seeing things that may break that pattern and break that rule of everything is temporary. And I am hoping and praying that this lasts a very long time, the new technology that she was exposed to. But we set expectations from the beginning. We said our goal right now is to survive, is to have your leg survive and make sure we don't have an amputation. That's the first goal. And then subsequently, our goals are going to change over time. And we're going to lay out options and see what's available for you.
And so this other doctor, right before she came to you, where was that line that he had drawn in the sand and said, I'm doing this one last, I think they were planning to do a bypass. I'm going to do this one last bypass and then we're done. It's all I could do.
Basically what they were going to do, if you don't mind me explaining, Camille, they were going to place a catheter through one of the bypasses that have failed on multiple occasions and place a clot buster basically through it. We call that thrombolytic therapy, which is, I mean, obviously this is also a super short-term solution. And sometimes it's associated with the big pieces of clot also migrating and causing problems down below. So I don't see in traditional teaching and the traditional school of vascular surgery and medicine, this is what's available right now. If one is not going above and beyond to try to help patients with extreme cases, the threshold for an amputation is relatively low. They'll say, that's it. You have no other options.
Okay, so they were not talking bypass. They were literally just going to send what they call the TPA, clot busting drugs, direct catheter delivery of these clot busting drugs. And then if it didn't melt the clot, then we're just going to have to take the leg.
Right.
Well, but part of the issue is that clearly there's a mechanical problem with the bypass, mechanical problem with the stents. So, we've exhausted those options. So you can reroute it another way. Or now, I don't know, Camille, did she have chronic limb threatening? I mean, was the limb?
Yes.
It was. So
yes, when I met her in the ED, she was at that point, rest pain, extreme ischemic clinical findings.
Which for our listeners, and we have 2 minutes left, at least in my opinion, when someone presents with those types of symptoms, it truly moves the needle as to how aggressive do we have to be. There's a difference between someone who has symptoms with exertion, but they can get along. But when the limb is truly threatened, I stop at nothing. And it sounds, Hady, like you did that as well.
Right.
And coming up next right here on The Heart of Innovation, we're going to hear exactly what ultimately has saved her leg and got her back on her feet and cheering.
Piggies, I hope. Are the piggies still there?
Yeah.
and cheering for her son at the baseball diamond. So stay with us right here on The Heart of Innovation on KDOW. Don't go away. Think one puff doesn't matter for your legs?
It's a poison that goes everywhere. These procedures that we do, or we put in a stent, the body's clotting system is ever so slightly more active. The addition of tobacco and nicotine will actually exacerbate or make that worse. It damages the lining of the blood vessels throughout the whole body. It spasms down with more nicotine. It's a vasoconstrictor, and so it gets tight. And that is a catastrophe if that happens.
Nicotine makes your smallest blood vessels spasm and shut down. It literally starves your legs of oxygen. The secret to beating the craving? The 3-minute straw hack. Cravings only last 3 minutes. So take a straw, put it in a water bottle or in a glass, and sip ever so slightly for the full 3 minutes. Even chew on the straw just a little bit. It mimics the behavior of smoking without the poison. Stop the spasm,
Save your limb. Watch our full episode with Dr. Lily Johnston to reclaim your walk.
Welcome back, everybody. So we've kind of teased this whole Save My Piggies as to what Dr. Lichaa ended up doing to help Miss Camille. But so Camille, before we get into what Dr. Lichaa did, can you explain to us, because we've been talking during the break about you quitting smoking, right? And there's a story that I have to share because a patient, because of the Cures Act from 2022 or whatever it was, patients have access to their medical records. And I remember a patient, I brought her into the catheterization suite for a procedure, and she read my note. And my note had said, we will try. I knew she had blockages in the leg artery, and I said, I will attempt to open this up. But unfortunately, she continues to smoke, and the durability of this procedure is going to be, I think, truncated because of this. And she said, Dr. Phillips, I saw this from you, and just so you know, I quit smoking like 2 days ago. And I was like, you know what? That's fantastic. So you were motivated enough, right? You quit smoking, and now Dr. Lichaa is going to unleash some mad skills and try to get you some better blood flow, right?
But it was literally that was the hospital stay that you met him, right?
I have felt some tremendous guilt because if I was going to have a doctor that was going to fight for me and fight for my leg, that I had to do my part. And my part is taking care of myself and walking and eating healthy, but it's also a tremendous help to quit smoking. I thought I would never be able to do it, and I had to go to counseling. And
awesome, though. That is awesome.
Yeah, after some counseling and a good long 5-day stay at the hospital, that helped too. So so I've been doing great since then.
That's amazing. So you met Dr. Lichaa, you had to go through the emergency room. You were on deck for a procedure at another hospital, but in the pre-surgery consult, you ended up with high blood pressure. You had some nosebleeds. She said, go to the ER. And the ER doctor was like, well, thank goodness you came here. I have the perfect person for you. So bring us to that moment where you actually met Dr. Lichaa and what that conversation was like compared to the other doctors that said, we've given up hope on you.
Well, it was wonderful because at that point, that was the second doctor that had said, listen, this is going to be the last procedure. I'm out of options for you. So I met the doctor in the ER, and he said, I've got this great doctor, Dr. Lichaa, you got to meet him. And he specializes in this type of thing. And so I met him, and Dr. Lichaa was fantastic. He said, not only do I have plan A, I've got plan B, I got plan C, I got plan D. So we will make sure that you don't lose your leg. And he has done every bit of that. And I would look tremendously different if it wasn't for meeting him that day. So
what were your plans? Let's talk about the plans.
Yeah, what did you see that no one else saw?
Right. Yeah. So obviously, I knew the bypasses are a no-go at this point. We had to go through the arteries that she was born with and reconstruct and find out why the stent that she had almost 10 years before I met her, had failed. And it was one of those nitinol stents that Dr. Phillips identifies just looking at. It was literally broken in 2 pieces at the joint level. And it was kind of, the technology was old and, there were other options, but regardless, we're dealing with a stent that's broken in 2 pieces and the body has kind of formed scar tissue around it. So forgetting all the bypasses, we were planning on going through this structure, the artery that's now obviously significantly diseased, and to kind of basically exclude that broken piece of metal out of it with a covered stent and with another stent that can withstand the forces of traction, flexion, extension of the joint. And thank goodness now we have the technology to do that. So I was planning to do 2 layers of stents, one to exclude and one to give her the resilience to last longer. And of course, this is an extensive procedure. The entire leg was blocked from top to bottom. So we had to work for about 6 hours. I remember that case. We were literally fighting, and my team was as motivated as I was. And I really wanted to save her. And it was obviously extremely difficult. And we got to a point where we got through that, like we literally burred a tunnel from one side, another tunnel from one side, and we were trying to connect those 2 pieces together. And literally everything would bounce on the piece of metal that's broken and kind of divert from the artery. So this is hour number 6. And of course, she's under anesthesia and all of that. So we had to weigh the risks and benefits. So I decided to stop, but I knew we were very close. Like, I wasn't like disappointed. I knew that there's a way through it. And of course, when she woke up and told her all about that, it was, emotional for both of us. And but we decided to fight another day. And
but just for our listeners too, hour 3 is long. Hour 4 is longer, 5, 6. I mean, like you gave it the old college try. I mean, like that's kudos.
I was literally going to war with this
you were
artery.
going to war. Yeah. Well, it sounds like the artery maybe have won the battle, but not the war, right?
That's right. And we decided, you know what? Now that we got to a point where plan E or F at this point, we were going to use an electrical wire to kind of puncture through that without bouncing off this piece of metal. And this is where I decided to bring her back and go straight down and use that electrical wire. And we subsequently crossed that. We opened it. The issue is just a technical thing that led to this blocking again. And then at that point, I was literally very optimistic about a new technology where we can give her another bypass around this problematic area without open surgery. And this is what she got.
Yeah. So she already had 2 bypasses, right?
Right.
What was it? They were both into, they landed behind the knee in the popliteal vessel, or were they one behind the knee and one down lower into the calf, into the tibial
That's
vessels?
right.
Okay.
Yeah, the first one was in the popliteal behind the knee. The second one was all the way down to her ankle.
Oh,
And
wow.
that also had multiple stents in each one of them.
So walk us through what we call the PTAB procedure, the detour procedure. It's a minimally invasive bypass, because there are some that have told me, well, she's already had this other bypass, so we can't do this minimally invasive bypass. There's no option. Where did you find a landing zone to
That's right.
reattach?
A very good question. This is the biggest difficulty in her case, because obviously we did not have a landing zone. That entire area was already eaten up by scar tissue, disease, the metal, and the multiple surgical procedures that she's had. So we had to come up with a modification of that procedure where we had to go from the foot and place a stent in the artery called the tibial artery, and then puncture the device that is used to provide the bypass without open surgery is a needle-based device that we use to puncture from the artery to the vein, vein to the artery. So we use that to puncture into the tibial artery instead of the popliteal artery, which is what it's designed to do. But we had to change it a little bit for her because her anatomy would not fit the typical mold. So we had to change it and puncture into the tibial stent. And then we gave her the stent that's meant to be in the popliteal artery into the tibial artery. That's what kind of made it really successful.
Well, coming up next, right here on the Heart of Innovation, we're going to find out how she's doing now. So stay with us right here on KDOW in this very special Save My Piggies episode of the Heart of Innovation. Don't go away.
Your type of condition is called critical limb ischemia. It's the most advanced form of PAD, or peripheral arterial disease.
Every 4 minutes, there is an amputation in this country due to PAD and diabetes. We also know that 85% of these amputations are preventable with early intervention.
It's a flip of the coin. Patient prognosis is tied to whether or not they are referred to a true expert in the management of peripheral arterial disease.
Do you know if your physician is an experienced CLI operator?
When you're in the hospital dealing with doctors and stuff, you figure they know what they're talking about.
The skill level varies doctor from doctor and hospital to hospital.
Patients with limb threat are in constant fear. The depression that someone experiences after they lose a limb is equivalent to those of losing their spouse of 40 years.
I was stuck in a wheelchair close to 2 years and my husband had to quit work.
I didn't know what to do at this point because we had had nothing but infections and hospital stays and infections and hospital stays.
And they took one toe, another toe, and then it was another toe, and then half his foot before he was even diagnosed with PAD.
And all I heard was, "What are we doing here? Just cut it off." And I pulled the curtain back like, "Are you kidding me?"
Do you really want to go through all that?
That's crazy. That's insane.
The protocol is to send them to amputation. Always, always, always get multiple opinions.
We do have options.
We need to listen more to our patients.
If you're going to chop off their leg anyway, why not just let someone else try?
This is the progression. First comes the wounds, and then comes an amputation. And I wasn't going to accept that.
So that's what it's like to try to save a leg.
Welcome back, everybody. So we're rounding third here. Another Save My Piggies. Camille, you've got this fantastic physician who went literally above and beyond the call of duty to get after the leg arteries and did the detour. It was successful, it sounds like. How you doing?
It was absolutely successful. I've already had a follow-up ultrasound that showed that it's still functioning very well. I'm walking well. I just actually did a trip to Orlando, and with a few stops, I did just over 4 miles. So, yeah,
awesome.
I'm doing really well.
What do you think, Dr. Lichaa?
I mean,
That's
this
a lot
is
of
a
walking.
record. This is definitely a record, and I knew she can do it. She can do anything.
Yeah. Well, I can't say enough how grateful I am to you, Dr. Lichaa, and to this procedure and giving me hope, and I appreciate it.
Now, Camille, would you
My big
have
honor.
it sounds like you were mentally kind of beaten down there through this process. How close were you to kind of just throwing the towel in? And what can you tell our listeners to just never give up? You know, squeeze as much juice out of that orange if you can.
I'm one of those. I've always been one of those people that, you know, if someone tells me something and I'm not quite sure, I do my own research. So I can't stress enough, do your research. Get online, research new procedures, talk to other doctors, other nurses. I have 2 great friends that are nurses. One was actually a nurse, and she was a nurse with my first vascular surgeon. So she knew him really well and recommended him highly. But he was the first doctor I started with. And he ran out of options a very long time ago.
What do you think that's like, just and off the top of your head, what do you think that says about our healthcare system? Because, I mean, the physicians that you went to ostensibly want to help you, right? And they just kind of ran out of options. And so, I mean, is every patient to just be like, no, I'm going to find somebody else. I'm never going to give up. Like, doesn't fundamentally that not make sense?
You know, you would think that your doctor's there with all the options and, you know, has done all his research. And it just kind of boggles my mind that these doctors aren't getting together with each other and sharing what they know and sharing their knowledge. I don't know if it's an ego thing or if it's because he works for this hospital and she works for that hospital. I'm not quite sure, but I can't stress enough. Don't give up. If someone tells you no, don't think that is your last option, because if I would have listened, I would look very different today. So
you have all 10 piggies.
I have all 10 piggies. I do.
All right.
Any last bit of advice, Dr. Lichaa? I mean, based on this, you know, scenario, I mean, especially in your area, I mean, she went to the emergency room how many times and she had the real signs, but what does that say again about our healthcare system? Tell our patients what they need to know when they're presenting with these types of symptoms.
Yeah, I mean, this condition is also pretty special in a good way and bad way, because not only the most educated doctors and providers not looking for it, but even if they want to look for it, they don't have the tools and the education and the knowledge to know that this field has advanced in a major way and there are things that can help. But so you're facing a broken healthcare system, patients who cannot find a medical provider. And on top of that, the actual medical condition is pretty complex. And you find multiple levels of expertise in that. And unfortunately, in some parts of the world, in the country, big vascular centers, the traditional thinking has not worked in 100% of the time. There's still 10 to 20% of cases that require thinking outside the box and require further research, like Camille was saying, about alternative ways.
Different doctors, different approaches, different tools. Innovation is moving at the speed of light and taking care of disease that's more prevalent and deadlier than most cancers have combined. If you are having leg cramps or neuropathy, you have trouble walking, make sure you ask your doctor about peripheral artery disease and call the Global PAD Association's Leg Saver hotline.
Please tell them to examine you.
Please tell them to examine those piggies. Save those piggies. 1-833-PAD-LEGS. Have a great week, everyone.
Thank you so much for sharing your story. That means a lot.
I can't tell you how grateful I am to have, miraculously, I really think it was the hand of God that led me to Dr. Lichaa. So. And
I do believe that too, that God put you in my life for a reason.
Yeah.
And I take it very seriously, and we're gonna keep winning.